heard it. Uh-oh.
Hello, everyone. Happy Wellness Wednesday. It's Robin and Kim here for our health chat with a special guest today who is Mr. Greg Andes. He's my son. So, what we're going to talk about today, as you saw in the notes, was falls. The statistics are staggering. So, I'm going to start out with statistics, talk a little bit, and then Greg is going to come in here and he's going to tell us ways that these things can be prevented. And why, you might ask, do I have my son coming in here to talk about this? It's because he is an expert, right? Greg is a physical therapist assistant coming up on 10 years. He was the director of rehab at a skilled nursing facility in Westerville for almost 5 years. And then he is currently a regional director of operations for rehab strategies, overseeing day to day operations in various skilled nursing facilities. So he has definitely seen his share of people who have fallen and knows how to help people prevent it. So, but before he tells us that, and we do have a few questions for him, I'm going to go ahead and just read these statistics. And one of the reasons I wanted to talk about this was because when I went to the Orthopedic Institute for my various replacements that I've had on my body, there were always signs up in the little rooms about falls. And I'm sitting there and I'm like, why are they so crazy about these falls? And I'm going to tell you right now why. So here are some of the statistics. 1 out of 10 falls results in an injury that causes the older adult to restrict their activities for a day or more to seek attention from the healthcare system. Each year, there are about 3 million emergency department visits due to older people falling.
Wow.
Each year, there are about a million fall related hospitalizations among older adults. In 2019, 83% of hip fracture deaths and 88% of emergency department visits and hospitalizations for hip fractures were caused by falls. That is crazy.
Yeah.
Each year, nearly 319,000 older people are hospitalized for hip fractures. Falls
Mm.
are the most common cause of traumatic brain injuries. Um, and then I'm going to read you on. And it says in here too, it's not always older adults that are making these statistics. It's construction, people who work in construction. So that can be various ages. Um, and then this last statistic in the US, falls are the second leading cause of unintentional injury related death. Second
Wow.
leading cause, responsible for 46,653 fatalities in 2022. That is a lot, with older adults 65 plus being the most vulnerable group,
Mm.
experiencing a death rate of 69.9 per 100,000 population in 2023. Globally, falls cause approximately 684,000 deaths annually, with over 80% occurring in low and middle income countries. So
Wow.
it's a lot. And I'm going to say, it's a big problem. So, Greg, can you give us some tips on what we can do to prevent this?
Yeah, so part of the working in the skilled nursing facilities, we were able to offer home assessments. Home assessments were basically just a quick overview, usually with one, sometimes two therapists. We would just go out to the house. If we had someone that was there for a short-term visit, we rehabbed them, got them better. We would offer to go to their home and then give suggestions. Some of the biggest things, it's really like making things accessible at home. That's really the big thing that we really look for at a lot of places. And then also eliminating some factors that would just bring potential fall risk and issues. Some of those that you don't think of, you walk into your house, the first thing you have is your entry rug. Entry rug, that's one thing that we usually typically after someone experienced, whether it was a fall, a fracture, they're coming back home with a rollator, a walker, a cane, even a rug that wasn't even, especially if it was a non-slick rug. That was one thing that we kind of wanted to get rid of. And usually you walk right into the house. It's one of the first things you see is a rug
Of
laying right
course.
there. Um, Another thing, just clutter, anything that's just kind of sitting around, that's maybe in a way or not making a hallway accessible, is something that we kind of looked for. But we would really go through like each room, we'd go through the intro. Well, first we'd see, steps. That was always our first question. Do we have any steps to get into the house? So we would practice steps at our facility and try to mimic as closely as we could how many steps they had, handrails, what side they were on. It got interesting when there was only one, you know, right hand side handrail, but then they're using the right hand to try to use the walker. So then having to educate and
Oh.
do everything the correct way, was a process a little bit that had to take a little bit of practice for them to catch on. But then, yeah, so getting into the house, we would go through the entryway, but then the kitchen and the bedrooms and the bathrooms, that's what we're primarily looking at. As far as the kitchen, you just want everything accessible, be within reach. The things that you used to have in the cupboards that you don't typically, that you use on a regular basis, making those within hand's reach, making things accessible. If you don't have a lot of room on like counter space, or if you're lucky and you do have a lot of counter space, use that. That's something that we want to just, no reaching or standing on your tippy toes and trying to reach for something, like you said, yes, this applies to maybe the elderly, but simple little things, you lose your balance and then slip, and then that's where the falls happen.
Mhm.
Um, Another thing too, when we kind of make our way to like the bedrooms, it's the same kind of thing. No mats, no rugs. Um, and then once we get to like the restroom, that's where we do offer a little bit more assistance. There are adaptive equipment. We have grab bars that you can put in shower tubs to make life simpler. The non-slick skid mats that you put on the bottom, so you're not slipping in the shower. There's the shower bench that you can do, that you set half on the in the shower, half on the out. So if maybe you do feel like your balance is compromised, you could just sit down and take a shower if you don't already have a bench in there. There's toilet seat risers. There's more grab bars that you can put. So there's a lot of things, adaptive equipment that we would usually look out for. But it all pertains to like how the person is. What is their challenge? What do they need help with? And then we can usually try to find or at least make easier their situation before, and those aren't long-term fixes. Sometimes they are. Sometimes they just need them for a little bit. And then once you get that strength and get it a little bit better, then you can go back to your normal ways. But the big thing I think really is just with that overall assessment, and it, makes it easier for a lot of people, is just get those rugs out, making, little things, changes around the house potentially. This is one that I tell my parents. I don't think they're at the age yet, but the doorknobs around your house that you just twist, changing them all to lever knobs, just so you're able to just pull. We've had instances in the past where someone has fallen and they can't get through the door because it's a twist knob because they're on the ground and they can't do anything. Whereas
Oh
if
my
you've
gosh.
had if you were able to just pull down that lever, that would prop the door open. So little things
Wow.
like that that just make, that you don't even think of, that we've just kind of seen over time in different situations that, hopefully lessen the chance of it occurring again.
Right.
Yep.
So I train a lady who has osteoporosis. All right. So of course with falls, I have to be very careful with her. She has to be very careful. So I
Mhm.
do when I personal train her, I we go through a whole series of balance. So
Mhm.
are there things that you would do as a PTA to teach these people, to help them with balance? What are some things?
Oh yeah, balance is a huge part. I've always been a firm believer in strengthening first. Myself, if you're not strong, like you have to be strong enough to be able to hold yourself up in the first place. But once you've hit in those kind of strengthening aspects, then you can get into balance. And balance, I mean, I was always the one to kind of test the limits of everybody. I think my grandmother can attest the exercises that I gave her potentially were I wouldn't say questionable, but they're more high level. I mean, it varies on every person. My, grandmother thankfully has been very active and everything throughout her life, so I could be able to give her more exercises. But yeah, as far as balance goes, I mean, any type of foam exercises, two leg, one leg with handed support. You could add banded, like stepping exercises with weights on and off of the foam pad. But foam, I mean, that was a regular, you could ask any therapist. The foam, that is a huge part of our rehab balance strengthening part of rehabilitation.
So would
What does
foam be like, kind of like a Bosu ball? Is that
Yeah, just like it's like
like
a
kind of the same?
square foam
Okay.
piece. Yep,
Okay.
that you
how how tall is that foam piece and how big is
they
it?
vary, but anywhere from 1 to 3 inches.
Okay, but it's basically because it's unsteady when you step on it, right? Because it's you're
Yeah, there's like there's levels. So, we'll do a standing exercise on the flat ground. They do well. We'll put the foam underneath them. We'll practice with the foam. They do well. We can go to a Bosu ball. And once they kind of master the Bosu ball, honestly, you're kind of in a good place that if you're, standing on a Bosu ball, doing squats or doing steps onto a Bosu ball, your balance is, at that graded good balance. So,
that's pretty exceptional if you can balance
yes.
on it too.
Yeah.
Yeah. So that's interesting you say. I was going to ask the same thing, Robin, about balance because I think that is such a huge part. And I teach an osteo class and we do work on balance. Like we have a chair and we practice with lifting one leg up and
Mhm.
lengthening your leg or whatever. But I give them the option. I said, put your hand on the chair, but try to not hold on to the chair if you can, just to see where your balance is, but it's there if you need it. But it's a good place to start. That's something you can hold on to and then work on your balance that way. I think that's really great. And
Yeah.
Greg, you made me think of all my bathrooms, like what kind of rugs I have in there, and all the bathrooms with showers and stuff. All the rugs are sticky, like they stick to the floor, so that's
Yeah.
okay, right?
Yeah, definitely more preferred. I mean, depending on the situation or circumstance with the patient or resident or whoever, I mean, some we would just throw out. Like if I knew it was going to be an issue, it would just, hey, we recommend just get rid of them. And some gave us a hard time. That was the fashion, interior design people that we worked with a little bit that really wanted something on the inside. My mom would be one of those. Um, people. But no, as long as it's like the non-skid
Yeah,
mats, those would be preferred for sure.
perfect. Okay, good. Because I have those, but
Yeah.
I didn't want to get in
Yeah.
trouble. Yeah,
I would say too, medications are
mm,
another issue, right, Greg? I mean,
Oh,
especially
for
when you were at
sure.
the nursing home. So,
Yeah, for
uh,
sure.
to me, I think, and I'll just say this really quick. I think Kim's got a couple things to talk about personal that in her life that she knows about. That my mom fell, which is Greg's grandmother that he's talking about probably 2 months ago. I was over at her house and I said, "What happened to your phone thing?" She had like a little handle on the back of it. She goes, "Oh well, I just lost my balance and I fell." And I'm like, "What?" And she was on like this medication that made her balance just slightly off, and she just went to turn to go in the living room and just fell. But she said she fell very gracefully and didn't hurt anything. But I think the
good.
whole thing is when you're on medications, you need to be cognizant of your balance and be in the moment. So think about what you're doing and not making quick turns and moves like Greg said earlier, make things accessible so that you don't have to reach very far because your head does, like when you're on medicines, it plays
Sure.
tricks on you.
Make you dizzy and yeah,
Yeah.
for sure.
So anyway, but go ahead, Kim. You had some.
Yeah. No, I have in my own family, I've seen where falls have affected them. And my grandmother, when this is probably in the late 80s, she fell, my dad's mother, she fell. She was living by herself in an apartment, and my dad, she wouldn't answer her phone. So we finally went over to check on her, and she was there for like maybe 2 days or a day or so, at least more than a day. I know that. And found her, she fallen in her kitchen or whatever and broken her hip. And this was before, you had cell phones and before you had probably those necklaces for a call button.
Right.
But she ended up breaking her hip. She never recovered from that. She became bedridden. And I remember she was losing her language, and I couldn't understand that just from breaking your hip. Like she lost all her mental capacity. And later I've learned is that leg strength equals brain health. So keeping your legs strong has been shown to keep everything strong, your mental health, your physical. But when you lose that leg strength, you lose your mental capacity as well. And Greg, I don't know if you've noticed that or can speak to that as well. But I thought that was interesting reading about the studies about that.
Yeah, yeah, absolutely. There's a correlation. My biggest thing I always used to tell everyone, yeah, you have to keep moving. Keep moving. That promotes blood flow. Blood flow keeps the heart going, keeps the brain going, keeps everything going. So it might not feel like a lot, but even like, you get older and maybe not the exercise that we're familiar with when we're younger or anything like that, but like a simple like walking on a regular basis, finding that hobby, the biking is another one, great hobby. I think better than walking personally, but um, keeping movement, you have to stay active. You don't stay active, you start losing things. And then that's when kind of everything starts going. And yes, I've definitely seen that over time.
Yep. Your mom has a good saying, if you rest, you rust. I always like that.
Yep.
Yep.
And
Yep.
so I think the generation above the baby boomers are the ones that are really been hit hard by this too, because we've had other family members who have fallen. Another one in her 80s fell, broke her hip, and she passed away a year and a half later.
Mm.
And then my mom has fallen. She's 91 now, but she was in her upper 80s. She just fell in her kitchen. Like she's not sure what she did. She just fell. And luckily she didn't break anything. Thankfully, we're thankful about that. But she's very frail and has osteoporosis. And then we have another family member who fell and broke her back. And so she's recovering from that now. And it's just, Dr. Vonda Wright, I don't know if you guys are familiar with her, but she is a orthopedic doctor, and she talks about bone health in women. And she says women, as they get older, their bones become like butter, and they can break even like without like breaking their bone. They'll break their bone and then fall down, because
Oh,
their
that
bones are so
causes the fall. Yeah.
that
Yeah.
causes the fall, which is really
Makes sense.
interesting. Yeah, and so that's a thing to think about as well. But I feel like the baby boomer generation is maybe a little more active.
Mhm.
And even though that older generation had Jack LaLanne, I don't think everybody followed Jack LaLanne. Greg probably has no idea who I'm talking about.
Yeah, I think he does. Maybe, maybe not.
Maybe
No,
not.
he's
Not
like,
sure.
no,
Nope.
No, he's not that.
that was
he'll
way
take, like,
before his time.
yeah, yeah.
Yeah.
Our mothers watched Jack LaLanne on TV, and we were little when we saw
Yeah.
Jack LaLanne. Anyway, he was
But
always
I
doing.
think pickleball has helped the boomers, I think. But although there's a lot of injuries from pickleball too, but they are active.
I was going to say that's split a little bit because
Yeah.
it's getting people. I've seen pickleball injuries. I've seen, wanting to get back that activity to get you back into it. And it sometimes can be just a little bit too much, but
Yeah.
Achilles injuries, knee injuries associated with the pickleball. So it's like, that's why I always just keep moving. I mean, I understand time, life happens, things happen. You're not doing what you're typically doing, but easing into it and then realizing when you are getting a little bit older that, okay, now I got to find my new pace. Like, what is my new norm? And that's very difficult for a lot of people to put their head around because, even myself, I'm 36. I feel like I'm still like 22. I could go out and do whatever. It doesn't really matter. It still takes a little bit of time to just get warmed up, get my routine going, have a different routine or approach, and then it's going to continue to happen as I get older. So,
Yeah.
I think the key is like staying active, like,
Yep.
and not moving. And like you said, do you find that when you work with seniors or anybody preventing falls, do you recommend any strength training for them, or is it more just therapy for the functional movement?
yeah, so yeah, a little bit of both, but definitely an advocate for strength training, whether it's lower body, upper body. In the nursing homes, PT and occupation or physical therapy and occupational therapy, we kind of split it up a little bit differently. Still able, like physical therapist assistants, occupational therapy assistants, still able to work kind of whatever. But in the nursing home, it tends to be PT, lower body, OT, upper body. But no, big advocate for strengthening. I mean, that's kind of that's the basis. That's how everything gets moving. You got to be able to stand yourself up. You got to be able to move. I mean, and even initially, you have to be able to move out of the bed. You got to be able to position yourself to get onto the edge of the bed to be able to stand up or pivot or whatever you're working on. And obviously, There's different tools that we use to make life simpler, if depending on your function level and everything. But no, strengthening is definitely a huge factor to get you back to your normal or to prevent any falls.
Yeah, that's great. I'm glad to
Yep.
hear that. Yep, thank you. Anything else you want to add, Robin?
I don't think. Greg, anything else you can think of that you might have?
No, I don't think so. Like I said, just the biggest thing for homes and this fall prevention idea that we're talking about is just accessibility. Keep everything that you do use in a safe and accessible
Mm.
area,
Mhm.
way everything. So that's really kind of the big scheme behind it, and keep moving. That's the big point.
And that's not just for older people too. I mean, that's for
No,
younger people
absolutely
too. Keep
not.
it accessible. Why do you want to go reach for something and have one foot on the ladder and one foot on the, yeah. So,
Right.
I mean,
I
I'm
think,
saying this because I've done it before, which is stupid,
Yeah.
and then
yeah,
you're in trouble. So,
I think we all have, but I think it's common sense stuff too, about keeping like
right.
roads that aren't slippery, just things that could cause you to fall, clutter, whatever, like you said. I think those are good common sense things.
Yeah.
Yep.
Yep.
So thank you so much for joining us. It was
Yep.
really fun
Thanks,
having
Greg.
on, Greg,
I
and
Yeah,
appreciate it.
yeah, you
absolutely.
appreciate your expertise and joining us and educating, because I think that's really important. Because maybe people learned something today they didn't realize before. So
Right.
that's good.
Right.
But we just want to thank you for joining us, and we hope you have fun and live young, and we will see you next week. So take
Great.
care.